Now, the U.S. now has the highest death toll in the world, and total cases triple that of any other country. New York City, the country's hotspot, recounted its fatalities and added another 4,000. Now, that brings the city's death toll to more than 10,000. But Washington, D.C. seems to be fighting a battle on different fronts. Let's find out more from our U.S. Bureau Chief, Simon Marks. Simon, thanks for joining us today. Let's begin with the number of cases and deaths. We've seen another record in terms of fatalities. But are there signs that the outbreak is peaking or close to it?
Well, certainly Governor Andrew Cuomo in New York believes that the worst is over, as he put it a couple of days ago, not based on the number of fatalities that he's still witnessing, which are obviously tragically high. And as you know, New York City has adjusted the death toll upwards to reflect the large numbers of people, around 4,000, they think, who have died at home in deaths that were not initially attributed to COVID-19. But Governor Cuomo bases his conclusion that the worst is over on an examination of falling numbers of requests for new hospital beds and reducing numbers of requests for new beds in intensive care units. He says that at the moment, the state has the number of hospital beds and ventilators, for example, that it needs to cope with this crisis. And he's talking gingerly about looking at ways of reopening at least parts of New York State's economy. He's dealing with other governors on that. But the concern here is that there are other hotspots out there where the infection may not yet have peaked and new hotspots that the United States hasn't even recognized yet as hotspots that may emerge further down the road. So very difficult to say that as far as the US nationally is concerned, the peak of infections is past.
And in terms of foreign affairs, there's been massive and worldwide condemnation on Mr. Trump's decision to pull funding from the WHO. And what's the latest on that? And what can we expect out from DC on this?
Huge pushback internationally. World leaders internationally all saying they reject the president's plan and they have no intentions whatsoever of following suit. Here, he's under fire as well from people like Bill Gates, the Microsoft co-founder himself, a man who's been warning about the dangers of an international pandemic for many, many years. He said the plan to defund the World Health Organization sounds about as bad as it really is. The White House has responded by putting out a briefing note to reporters today detailing President Trump's objections to the WHO, insisting that the organization was engaged in a cover-up. There are no details provided of that cover-up of coronavirus, and saying that it was too credulous in accepting China's explanation of what was taking place in Wuhan when the outbreak was first reported. But remember, this is just a review that the US government is now proposing of the World Health Organization and US funding of it. We don't know if at the end of the day Donald Trump is really going to make good on this threat completely to defund the organization.
And last question here on President Trump's authority. You know, in California, Governor Gavin Newsom has laid out an outline to lift the lockdown. But Mr. Trump says he has the total authority. How do you expect this to play out, especially if more states start to unveil their own plans on lifting a lockdown?
Well, there's going to be a tug of war constitutionally over this, but Donald Trump is wrong. And that's a matter of constitutional fact. There are hardly any people, even in his own White House, who truly believe that he has the total authority to tell the states what to do. This is going to fall to the individual governors of individual states. And people like Gavin Newsom, the governor of California, I mean, he's thought more about reopening and the phased reopening of California than perhaps any other governor. He's talking about the possibility of authorising no mass events, sporting events, theatre performances in front of live audiences until September at the earliest. He's saying that restaurants might be able to reopen, but they would have to have tables distanced from one another. Schools might be able to reopen, but again, pupils would have to be distanced from one another. So those are some of the proposals that he's putting on the table. They will be examined by other governors governors, but this is going to fall to America's 50 governors to decide what to do in each of their individual states, just as they made the decisions themselves about locking down or not locking down their own particular states and territories.
Thank you, Simon. That was Simon Marks there, our U.S. Bureau Chief.